Well, the Inflation Reduction Act, which is a multi-billion-dollar spending bill, focuses on health care, climate change, and taxes, and now heads to the U.S. House where lawmakers will vote on it on Friday. But does the legislation make an expensive life-saving drug cheaper? Our Verify team takes a closer look.
Millions of Americans have diabetes and need insulin to survive, but the price of the drug is often expensive. The Inflation Reduction Act, a bill recently passed by the U.S. Senate, which in part aims to lower rising costs of goods while paying down the nation's debt, also includes provisions to make healthcare more affordable. But there are a lot of tweets like this one on social media claiming that Senate Republicans just succeeded in stripping the $35 per month insulin price cap from the bill, keeping insulin prices high for Americans. So let's verify. Was the price cap on insulin removed from the Inflation Reduction Act? Our sources are the Inflation Reduction Act of 2022 and the Centers for Medicare and Medicaid Services. This claim needs some context. The final version of the Inflation Reduction Act, passed by the Senate, does cap insulin prices for some people, but not for as many as originally intended. Let me explain. The original text of the bill capped insulin prices for both Medicare and private insurance patients at $35 a month. But the cap for patients with private insurance ran afoul of Senate rules, forcing a separate vote on that provision, which failed to get enough Republican support to pass. As a result, the approved bill caps insulin prices at $35 a month for Medicare patients only. More than 63 million Americans are enrolled in Medicare, and 1 out of every 3 Medicare patients has diabetes, according to the Centers for Medicare and Medicaid Services. So we can verify that the Inflation Reduction Act still contains a price cap on insulin, but it only applies to Medicare patients and not for people with private insurance. With your Verify, I'm Ariane Till.